Welcome back to another episode with Dr. K.
Hi everyone.
We're going to talk about your skin health and reproduction. So I think we discussed that hair loss is a very common thing, and it happens during the menopausal transition, especially women with low ovarian reserve. When the ovary starts to function less, they also tend to lose hair. Now, hair loss can be reversible, I think. Sometimes. So we're gonna go to Dr. K, the expert. Thank you again for coming to my house.
Thank you for inviting.
Welcome.
Thank you.
So tell us a little bit about what are the reasons of hair loss?
So hair loss, people think about it as one condition, but it's actually many conditions. And the most common ones are androgenetic form of hair loss and telogen effluvium. And those, I would say that's approximately 70 to 80% or even more of all hair loss cases that we see. And if we talk about menopausal or premenopausal women, so we are mostly talking about these two types of hair loss. But of course, we have to investigate, and sometimes somebody may have different types of hair loss.
Got it. Now, I mean, the reason why in women with ovarian insufficiency it happens physiologically, estrogen that's produced by the ovaries is very important for hair growth, as far as reproductive endocrinologists involved, and the lack of the estrogen or the changes in estrogen to testosterone ratio. Testosterone is the male hormone, estrogen is the female hormone. We both have same hormones, but different ratios. So these changes can cause hair loss.
Yes.
Now, let's say I come to you, I say, Dr. K, my ovaries are not functioning properly, and I'm starting to lose hair. What are the tests that you do on me?
So I would want to be sure that that's indeed the only reason why your hair is falling. And I usually start with exam, and if there is no inflammation, if that's indeed just shedding or thinning or hair loss with no inflammation, the next thing what I would do a little bit of a blood work. I want to be sure it's not thyroid involved. I want to be sure it's
thyroid is very important.
Absolutely.
I mean, we as a fertility doctors, we measure thyroid at every single patient because it's very common to have abnormalities that can cause infertility and other things, but also
hair loss. Absolutely.
So thyroid, what else?
Thyroid. I always do tests for anemia, because in menopause and premenopause, anemia changes are very common, that they can lead to hair loss. I always check vitamin deficiency.
Which vitamins are the most important?
I usually check vitamin B12 and vitamin D.
I take both, by the way.
Yeah, that's important. And
I take zinc. I heard zinc is good for hair because I'm losing hair. Look,
yes,
see?
Yes.
Show them.
Yes.
But why I'm losing hair? I'm not in menopause.
Well, it's probably genetic. A lot of men have genetic.
My parents gave me all the bad genes, but anyway.
So, and also, I also check for some autoimmune markers, because also autoimmune conditions are very common, especially in Afro-American patients. And those are the main ones. And then we talk with the patient. Sometimes I include some other tests.
So hormonal changes, we check thyroid, vitamin D and B12, zinc, those are very important, and some autoimmune testing.
Yes.
Now, what are the treatments, and can I prevent them from happening?
So if we are talking about telogen effluvium, meaning that some changes in those tests are abnormal and likely causing this hair loss, we can substitute these deficiencies, and potentially the hair loss will
like vitamin D, B12, zinc to intake.
It's not very clear about vitamin D. I usually supplement very severe deficiencies, but so many people are deficient with vitamin D that I'm not sure if it's 100% connected, but I still like to supplement it if it's very deficient. So, of course, we pay attention on thyroid, and of course we treat all these big abnormalities which we find. But if we find nothing, then we are probably talking about female pattern hair loss because of hormones. And there are a couple treatments we can use here.
Which are?
We have FDA-approved medication, which is minoxidil, and it can be topical or in an oral.
So there's a cream and oral.
Yes, minoxidil. Not creams, a solution of foam and oral.
Okay.
And we have, if it's a menopausal female, we can use finasteride.
Okay.
Those are more proven medications, but we can use non-traditional methods, and we can try inject PRP, platelet-rich plasma. There are some supplements with sopalmeta, for example, that have some data to be relatively helpful. So those are two. We can use microneedling, some laser treatments, but those are.
So laser, you guys use laser right and left, like
absolutely.
You don't know what it is. Put laser.
Yeah, and there is a new regenerative methods are developing nowadays, exosomes or growth factors, but it's still a lot we don't know about those methods. Yes.
Great. So that was very, very helpful.
Thank you.
So any questions, any problems related to your hair loss?
We are
Dr.
waiting
K
for your
is always
comments.
available. Have a great day.